Sound check. Okay, ladies and gentlemen, we are starting anytime soon. Contestants, please take your positions.
Kailangan pa ba natin? Parang Sir, sa libang alisan na. Ipat na namin dito sa likod. Wow! Grabe!
May cheering squad ba kayo?
Habang nag-aantay tayo.
Oo. Paano na natin sila?
Simulan na ang cheering habang nag-aantay tayo.
Kasama daw sa judging yung audience impact. Pero pagka start na ng questioning, dapat quiet lahat ah. May 50 points daw yung audience impact eh.
Saan tayo ba magbabasa ng tanong? Ayun. Dapat ayusin ko para mabasa natin.
So ladies and gentlemen, I hope all the contestants are here. Everybody, let's settle in, and we are about to begin.
Mag-start na ba tayo?
Pag ganyan kasi para makita natin. Para hindi tayo tumitingin sa midboard.
Well, good morning, ladies and gentlemen, doctors. This is the 29th Philippine Rheumatology Association. Everybody, please give yourselves and everybody else a big round of applause. This is day number 2. Now, early this morning, we started the day by stretching those muscles, exercising your lungs when you went up and down the Baguio Botanical Garden. This morning, as we kick off another beautiful day, it's about time we exercise those minds with the first ever Rheuma Laban. Is everybody ready? I can't hear you. I said, is everybody ready? Yes, we are. Now, requesting on stage right now, your quizmasters, ladies and gentlemen. Please welcome Dr. Alan Cortez and Dr. Joseph Patricio. This is for the Battle of the Brains.
Habang naghihintay ng isang mic, another cheer for your training institutions! everyone.
So,
Kumusta naman yung mga nag-Rheuma walk? Mukhang wala pa sila, no? Baka napagod. They're here. So palakpakan natin yung mga sumali sa Rheuma walk. After reconnecting with nature, this time we're going to reconnect with the fundamentals naman.
so hello and good morning, PRA. Today marks the first time in 2 years that a lot of us are gathering as a society. And I think this is also the first time in more than 20 years that the PRA is returning to the City of Pines.
Yes! Alright, parang kahapon sinabi 2001 was the last time that PRA
Yes.
was here, no? So I'm sure everyone is brimming with excitement and happiness this morning. It's good to see everyone catch up. So kahapon there was a welcome dinner and everyone was very happy. Sorry I wasn't there. Welcome, dear Rheuma colleagues, to the summer capital of the Philippines, Baguio City, where the temperature dips are sure to make your osteoarthritis flare.
Yeah, that's true. I heard some have experienced already Raynaud's phenomenon with the very cold evenings and morning here.
Ako, sobrang lamig. Dapat nakakatamad maligo, no? So, hopefully we don't get the same frostbite na sinabi ni Prince Harry dun sa memoir niya. Delikado yun pagka nagkaganon. So, buti na lang, we're in a very warm and comfortable room. So, everybody who's here, sit back, relax, enjoy your chocolate or your kape as we open today's convention with the much anticipated, the first ever
PRA, Battle of the Brains, Rheuma Laban 2023. I'm Joseph Patricio, and with me is Alan Corpus.
And we are your hosts and quiz masters for this morning's exciting event. Now I can feel kanina lamig pero the heat of the competition is starting to warm up the room.
Yeah. Mukhang relax nga yung mga contestants. I think mas natatakot yung mga mentors.
Mukha nga, Jopan.
So, can you tell our excited training institution what is at stake here, Alan?
Well, the winner for today's event gets to take home this very elegant trophy, 8,000 pesos in cash, and of course, finally and maybe even more importantly, the pride and honor of being crowned the first ever champion of the Rheuma Laban. So let's begin by identifying the participants of the competition. From East Avenue Medical Center, Dr. Christopher Paul Kitikit, Dr. Mary Joan Gachitorena, Dr. Shayan Henolos, and the substitute Dr. John Maria Alvarez. Big warm round of applause for East Avenue Medical Center.
Wala bang cheering squad? There.
Doon pala ang kanilang mga mentors.
Now let's go to the Makati Medical Center. We have Dr. Noreen Marie Garcia, Dr. Eloisa Trina Generoso, and Dr. Joseph Peter Lim.
Okay, isang mainit na cheer naman para sa Makati Medical Center.
Ayan.
From the Philippine General Hospital, Dr. James Barte, Dr. Blessy Perez, Dr. Mark Adrianiano, and the substitute, Dr. Rohanifa Sarosong. Palakpak naman para sa Philippine General Hospital.
Cheers. Let's go to St. Luke's Medical Center.
Nako, 50 points yan.
We have Dr. Cherise Vergel de Dios, Dr. Leandro Jose Dado, Dr. Rica Kesha King, and substitute Dr. Elaine Tan. Mukhang maraming dala ang St. Luke's.
Madaming baon, malakas. And last but not the least, from the University of Santo Tomas. Kay Dr. Linton pa lang, 50 points na eh. Dr. Vincent Luceño, Dr. Barbara Jane Panopio, Dr. Carmi May Baladad, and substitute Dr. Marivic Bolando.
Okay.
Lakas ng cheer ah.
Mukhang excited na ang mga mentors.
Oo.
Now let us go through some important details and mechanics of the competition. 1. All accredited, tama ba? All accredited training institutions are qualified to field a team composed of 3 rheumatology fellows in training with a 4th one as a substitute member of the team. A substitution is allowed only once and may be done during the break. And the organizing committee reserves the right to approve any change in team composition.
Rheuma Laban, Battle of the Brains, is a quiz show with a point system for each round. The team with the highest accumulated points at the end of the third or the difficult round will be declared champion of the contest. There will be 3 rounds with 3 levels of difficulty as follows. So you have your easy, moderate, and difficult. Each round will be composed of 10 multiple choice questions, and there will be 4 options for each question. Points will be awarded for each correct answer in each round. 5 points for easy, 10 points for moderate, and 15 points for difficult. An electronic scoreboard at your sides will tally the scores in real time.
Okay. There will be a break of 5 minutes for every level. Each team will be provided 4 answer paddles, pwedeng paki-raise yung isa, bearing a letter from A to D. The questions will be read twice, and only when the quiz master says go, will the teams be allowed to answer. So hintayin nyo muna yung go namin, no? They will be given 5 seconds to raise the paddle with a letter that corresponds to their answer. This is very important, yung number 9, no? Raising the answer paddle before the quiz master says go, or the allotted time, or after the allotted time of 5 seconds will invalidate the answer.
Now, in the event that we have a tie at the end of the third round, we will have a sudden death competition. This will be comprised of 5 random questions of varying levels of difficulty, and the first one to reach 3 correct answers, or the highest pointer in this round, will be declared the champion. Now, all issues, queries, violent reactions will be addressed to the Board of Judges on my side, whose decision will be final. Any irregular action by a team or a team member which may be perceived as cheating will be brought before the Board of Judges for appropriate action. There will be corresponding sanctions by way of a warning, which is a yellow card, a point deduction, an orange card, and or permanent disqualification, a red card, from the competition.
Okay. The Philippine Specialty Board in Rheumatology will provide the questions for the competition. Sila lang nakakaalam nun.
Oo, di namin alam yung mga laman ng mga questions.
References for the questions will be from Boy Abunda Show. Joke lang. 11th edition of Firestein and Kelly's textbook of rheumatology, latest CPG guidelines and key journal articles, and PRA history. All issues, nasabi na to kanina. The Board of Judges composed of 5 members from the PSBR. The chair of the PSBR is the chairman of the Board of Judges. She is responsible for calling out sanctions given by the body and declaring the champion of the competition. The PSBR team are namely chairman, we have Dr. Lenore Lugi Lizardo, Dr. Sue Sel Saavedra is not present, Dr. Tommy Bangayan, Dr. Elizabeth Manlulu, and Dr. Ginger Alden Cabasan.
Excited na ba ang ating mga participants?
Yes.
Mukhang kinakabahan na no?
Ako nga rin kinakabahan
Ako din
So let's begin the first round. Ready? The easy round questions are worth 5 points each. Number 1 for easy round. What is the body's uric acid solubility threshold? A, 6 milligrams per deciliter. B, 6.3 milligrams per deciliter. C, 6.5 milligrams per deciliter. D, 6.8 milligrams per deciliter. Repeating. What is the body's uric acid solubility threshold? A. 6 milligram per deciliter. B. 6.3 milligrams per deciliter. C. 6.5 milligrams per deciliter. And D. 6.8 milligrams per deciliter. Go.
Higher, please. Okay.
Okay. Dapat nakita rin natin. Higher daw para makita ng judges.
Yeah. Okay. The correct answer is letter D. It's
D.
6.8 milligrams per deciliter.
So,
Can you please keep them raised for us to keep score?
so everybody,
Okay na.
we have St. Luke's, correct? Makati Medical Center, correct? East Avenue Medical Center, correct? UPPGH, correct? And yeah, no for University of Santo Tomas.
Alright. So, first question pa lang naman yon. Alright, for the second question, under the easy round, worth 5 points. The question is, what is considered the dominant genetic risk factor for spondyloarthritis? Letter A, HLA-DR4. Letter B, HLA-B27. Letter C, HLA-B5801. Or letter D, HLA-DR3. What is considered a dominant genetic risk factor for spondyloarthritis? Letter A, HLA-DR4. Letter B, HLA-B27. Letter C, HLA-B5801. Or letter D, HLA-DR3. Go.
One. Stop. Raise your answers.
Okay, raise them higher. The correct answer is HLA-B27, letter B. So, all the institutions got the correct answer. 5 points each for each institution.
For the audience, you can answer, pero tahimik lang, no? Tahimik lang. Number 3. What was the topic of the first Lourdes Manahan Memorial Lecture? Nakinig kayo kahapon, no? A. Rheumatology practice in the Philippines. B. History of the PRA. C. Evolving treatment strategies in rheumatic diseases. D. Challenges in organizing PRA. What was the topic of the first Lourdes Manahan Memorial Lecture? A. Rheumatology practice in the Philippines. B. History of the PRA. C. Evolving treatment strategies in rheumatic diseases. And D. Challenges in organizing PRA. Go. So dapat pala pag nag-round sila, may history na rin.
Tama, dapat alam natin yan.
Stop. Raise your answers. The answer is history of the PRA.
So, please keep your paddles up.
Paddles up. We have St. Luke's and Makati Medical Center. Got it correct.
St. Luke's and Makati Medical Center. Naku, 50 points na.
So dapat pala pag nagra-rounds na sila, may history sila, no?
I think dapat sinasama
history
natin
rounds.
yan. Oo. Alright, so next question. Which clinical feature is commonly seen among rheumatoid arthritis patients in contrast to patients with psoriatic arthritis? A. Dactylitis. B. Nail dystrophy. C. Symmetrical joint involvement. D. DIP joint involvement. Which clinical feature is commonly seen among rheumatoid arthritis patients in contrast to patients with psoriatic arthritis? A. Dactylitis. B. Nail dystrophy. C. Symmetrical joint involvement. And D. DIP joint involvement. Go. Time's up. The correct answer is C. Symmetrical joint involvement. All the institutions got the correct answer.
Question number
4.
5.
5.
5. What condition is characterized by calcification and ossification of paraspinous ligaments, especially the anterior longitudinal ligament in the spine with the presence of bridging and tesophytes? A. Spinal spondylosis. B. Ankylosing spondylitis. D. Diffuse idiopathic skeletal hyperostosis. And D. Osteoporosis. What condition is characterized by calcification and ossification of paraspinous ligament, especially the anterior longitudinal ligament in the spine with the presence of bridging and tesophytes? A. Spondylosis. B. Ankylosing spondylitis. C. Diffuse idiopathic skeletal hyperostosis. And D. Osteoporosis. Go. Stop. Raise your paddles. The answer is...
Can we show the options again, please?
Can we
we
show
go back
the-
one slide up? Okay, the correct answer is letter C. Dish. Diffuse idiopathic. skeletal
Okay,
hyperostosis.
everybody, may we have the response from the judges? C?
Okay, alright.
C.
Tingnan mo, napaka aware ng ating mga contestants, no?
Actually, hindi natin talaga nakikita to. Sila lang nakakaalam ng mga judges, no? Nagugulat na lang kami sa pronunciation.
Everybody got the
Everybody.
correct answer.
Yeah.
Alright, question number 6. Which of the following antibody tests, if positive, would mean that a patient has drug-induced lupus? A. Anti-dsDNA. B. Anti-U1RNP. C. Anti-histone. D. Anti-Smith. Which of the following antibody tests, if positive, would mean that a patient has drug-induced lupus? A. Anti-dsDNA. B. Anti-U1RNP. C. Anti-histone. D. Anti-Smith. Go. Timer. Stop. Okay. Correct answer is letter C, antihistone. Everybody got the correct answer.
Next question. What is the best treatment option for patients with carpal tunnel syndrome experiencing decreased sensibility and thenar atrophy? A. Splinting of the wrist in neutral position. B. Short course NSAIDs. C. Corticosteroid injection. D. Surgical release. What is the best treatment option for patients with carpal tunnel syndrome experiencing decreased sensibility and thenar atrophy? A. Splinting of the wrist in neutral position. B. Short course NSAIDs. C. Corticosteroid injection. Or D. Surgical release. Go.
Stop. Raise your paddles.
The answer is D. Surgical release.
Everybody got the correct answer. Very, very tight competition. Okay, next question. Number 8. What is the most common secondary cause of bone loss? A. Low calcium intake. B. Glucocorticoid therapy. C. Hyperthyroidism. Or D. Cigarette smoking. What is the most common secondary cause of bone loss? A. Low calcium intake. B. Glucocorticoid therapy. C. Hyperthyroidism. Or D. Cigarette smoking. Go. Absolutely. Stop. Okay. So the correct answer is letter B. Glucocorticoid therapy. So East Avenue Medical Center, University of Santo Tomas, and St. Luke's Medical Center got the correct answer. Again, KMC, UST, and SLMC.
Next question. Number 9. Which pattern on onset represents the most common early presentation of rheumatoid arthritis? A. Acute or intermediate onset. B. Atypical onset. C. Extraarticular disease. D. Insidious onset. Which pattern of onset represents the most common early presentation of rheumatoid arthritis? A. Acute or intermediate onset. B. Atypical onset. C. Extra-articular disease. And D. Insidious onset. Go. Stop. The correct answer is D.
Insidious onset.
Everybody
Everybody got the
got
correct
the
answer. Next question, and I think this is the last question for the easy round. So, what is the most common cause of morbidity and mortality in patients with SLE? A. Myocarditis. B. Nephritis. C. Infection. D. Effusion. What is the most common cause of morbidity and mortality in patients with SLE? A. Myocarditis. B. Nephritis. C. Infection. D. Effusion. Go. Time's up. The correct answer is B. Nephritis. Unfortunately, no one got the correct answer. Naku, lagot kayo.
Okay.
All right.
So that wraps up round 1. Let's go to the scores. Leading the pack is St. Luke's Medical Center with 45 points.
Followed by East Avenue and Makati Medical Center with 40 points each.
And UPPGH tied with UST with 35 points.
All right, we have 2 more rounds to play. Let's proceed to the next round. The questions for this round. Okay, time up. While waiting, cheer muna daw, cheer. Technical difficulties. Na-reset daw lahat ng scores. Thank you.
Pasabihan lang kami kung ready na. While waiting, kung meron mang substitution, we will allow substitution at this point.
Okay.
Dr. Rayu,
Dr. Rayu is disqualified from substituting. So, before we proceed to the next round, the teams may change their players if they so want to. So, paano nga ba na-start tong Rheuma Laban, Jopat?
well, napag-isip lang, originally, it was the contest between training institutions. It's the
Debate yata, no? Parang we wanted a debate initially, but we wanted to also engage the fellows and also the trainers. So para medyo maging participative lahat. And one of the consultants actually suggested na why don't we do a battle of the brains, tama ba?
Yeah, and we have a lot of maganda yung kanyang response. Ang daming gusto ng Rheuma Laban, Battle of the Brains.
So sa tingin mo next year dapat ulitin ba natin to?
Yes, I think we should.
So
We
di ba
should.
ulitin to next year?
Kailangan ba? So that
Alright. Consultants naman daw ang iruruma laban. Sabi ng Makati Medical Center. Magandang idea nga yun, no? May isa sila. Time's up na daw kami.
tapos na raw yung ad-lib namin.
Daldal ng daldal. Okay, so we have 2 more rounds to play. Let's proceed to the moderate round. The questions for this round are worth 10 points each. Question number 1. Who was the PRA president when the EDSA 2 revolution happened? A. Dr. Joseph Antigua. B. Dr. Roger Dulos. C. Dr. Sandra Tanque Torres. D. Dr. Perry Tan. Who was the PRA president when the EDSA 2 revolution happened? A. Dr. Joseph Antigua. B. Dr. Roger Dulos. C. Dr. Sandra Tanque Torres. D. Dr. Perry Tan. Go.
Dito yata sa Baguio yun, no? Yung PRA na yun. Dito sa Baguio.
Ito nga yata yun. Time's up. Okay, the correct answer is letter B, Dr. Roger Dulos.
Correct answers are from East Avenue Medical Center, UST, Makati Medical Center, and UPPGH. Next question.
Which else SLE antibody is associated with lower frequency of glomerulonephritis? A. Antihistone. B. Anti-dsDNA. C. Anti-SM. D. Anti-U1-RNP. Which SLE antibody is associated with lower frequency of glomerulonephritis? A. Antihistone. B. Anti-dsDNA. C. Anti-SM. D. Anti-U1-RNP. Go. Stop. The answer is D. Anti-U1-RNP.
Correct answers are from East Avenue Medical Center, University of Santo Tomas, and St. Luke's Medical Center. Lakas ng cheer, 50 points. Next question. Who was the PRA president when PRA celebrated its Ruby anniversary? A. Dr. Joseph Antigua. B. Dr. Roger Dulos. C. Dr. Sandra Tanque Torres. D. Dr. Perry Tan. Who was the PRA president when PRA celebrated its Ruby anniversary? A. Dr. Joseph Antigua. B. Dr. Roger Dulos. C. Dr. Sandra Tanque Torres. D. Dr. Perry Tan. Go. Time's up. Raise your paddles. The correct answer is letter D, Dr. Perry Tan. Only Makati Medical...
No.
So the only Makati Medical Center and St. Luke's Medical Center got the correct answer. Makati Medical Center and St. Luke's Medical Center.
Actually, nagtatali ang technical team, nagtatali din ang judges, and nagtatali...
I think the scores are not updated. Tama ba? Thank you
Okay.
for updating us. So, they're fixing it.
Next question. Which is a true statement regarding laboratory findings in rheumatoid arthritis? A. Increased erythrocyte sedimentation rate, typically more than 50 millimeter per hour. B. Rheumatoid factor seropositivity in approximately 80% at the time of diagnosis. C. Normal urinalysis. D. Mild microcytic anemia, less often normocytic. Which is a true statement regarding laboratory finding in rheumatoid arthritis? A. Increased erythrocyte sedimentation rate, typically more than 50 millimeter per hour. B. Rheumatoid factor seropositivity in approximately 80% at the time of diagnosis. C. Normal urinalysis. And D. Mild microcytic anemia, less often normocytic. Go.
Time's up. Raise your paddles. The correct answer is
C.
normal urinalysis. Correct answers are from East Avenue Medical Center, UST, and UPPGH. Next question. Question number 5. What is the most common skin phenotype associated with psoriatic arthritis? A. Psoriasis vulgaris. B. Gottate psoriasis. C. Pustular psoriasis. Or D. Erythrodermic psoriasis. What is the most common skin phenotype associated with psoriatic arthritis? A. Psoriasis vulgaris. B. Gottate psoriasis. C. Pustular psoriasis. Or D. Erythrodermic psoriasis. Go. Time's up. Correct answer is letter A, psoriasis vulgaris. Everybody got the correct answer. Okay, we'll take a break as we adjust the scores.
Ad-lib na. Kumusta na ang ating mga contestants? Yung iba nga nagkakape pa o hindi ninenervyos.
Oo nga eh. Parang gusto nilang lalong kabahan, no? Nakakatulong daw yon yung may some form of healthy na stress.
Tuloy pa, adlib.
Kumusta naman ang mga mentor? Yun ang dapat nating kumustahin. Dahil tingin ko, nagkakape din si Doc Evan eh.
Nakikita ko gumaganon yung kamay nila eh. No?
Yung iba kailangan takpan para hindi nakikita yung kung nakangiti or nagagalit na, no?
Ito, let's talk about the trophy, no? Parang crystal yata ito, no? Who would bring home that first ever championship or trophy for the PRA Rheuma Laban? Sabihan nyo lang kami, ha?
Alright, so how are you doing so far? Okay naman? Very confident ang East Avenue Medical Center. How about the other institutions? Kaya pa? Very good. Okay, ayan na, nadadagdagan na yung mga scores. So, antayin lang natin sila. So, next year, sa tingin mo ba, dapat consultants naman daw yung isali natin dito, Jopat? Mapalakpak yung mga trainees eh. Lagot kayo pagbalik nyo.
Past presidents.
Past presidents, oo nga naman. Can we hear a cheer for that? Past presidents daw, sasali. Baka i-revalid na tayo ng mga yan kapag... Bababa na kami, ma'am.
Andun yung sa...
Makuha sa tingin, no?
With that gesture, no, talagang kailangan ituloy natin for the trainer, fellows in training.
Tama. Sorry, fellows in training, I don't think you'll get what you want.
So starting after the convention, isasama na natin yung mga rounds natin, yung mga history.
And showbiz.
Ang showbiz, may nag-suggest kanina sa amin, no?
Tingin ko dapat isali yun eh. Kasi dapat para maging holistic na doktor, alam din natin dapat lahat yun.
Sino yung may artistang may SLE?
Tama.
Pwede ba yun?
Tatawagin natin si Dr. Hipe para tumulong sa paggawa ng mga showbiz questions.
Yes. Isama kaya sa PSBR si Dr. Hipe?
Pwede, oo. Nagta-thumbs up eh. So,
Thumbs
mukhang
up.
gustong-gusto niya. Sama niyo nga po.
Okay. Pwede na raw mag-resume.
Alright, question number 6.
Number 6. What do you call the syndrome due to partial deficiency of the enzyme hypoxanthine guanine phosphoribosyl transferase where patients present with early onset hyperuricemia, gout, and nephropathy? A. Lesch-Nyhan. B. Kelly-Segg-Miller. C. Marfan. D. Von Jerks. What do you call the syndrome due to partial deficiency of the enzyme hypoxanthine guanine phosphoribosyl transferase where patients present with early onset hyperuricemia, gout, and nephropathy? A. Lesch-Nyhan. B. Kelly-Segg-Miller. C. Marfan. And D. Von Jerks. Go.
Time's up. Raise your paddles. The correct answer is...
B. Kelly-Segg-Miller.
Okay.
Everybody got the correct answer.
Wow. Impressive. Next question. Number 7. What is the most common extra-articular manifestation of ankylosing spondylitis? A. Iridocyclitis. B. Pericarditis. C. Interstitial lung disease. Or D. IgA nephropathy. What is the most common extra-articular manifestation of ankylosing spondylitis? A. Iridocyclitis. B. Pericarditis. C. Interstitial lung disease. Or D. IgA nephropathy. Go. Time's up. Raise your paddles. The correct answer is letter A, iridocyclitis. East Avenue Medical Center got the correct answer together with UST and UPPGH. Next question.
Next question.
Bakit naging 10 points na lang? Ayusin daw. Time out. O break muna ulit.
Naubusan na tayo ng adlib.
Alam niyo, dapat si Junette yung nag-host nito eh. Kasi kwelang-kwela. Halika muna dito, Junette.
Yung mga mentors nila may morning stiffness na, no, natatakot sa kanilang mga trainees.
Tingin ko nakafixate sa scoreboard eh. So mukhang tumigis na yung leg, no?
Lagot
May
tong
partial
mga
pain
to pag
syndrome na.
nag-rounds.
Yung bang mga participants natin sumali kanina sa Rheuma Walk?
Sumali ba kayo sa Rheuma Walk kanina? Wala.
Baka daw kasi magka-brain fog kapag na-expose sa lamig, no?
Excuse. O yan, ready na
Okay,
ulit.
ready na
Let's
daw ulit.
go for the next question. Which of the following is an unlikely radiographic finding in patients with erosive hand osteoarthritis? A. Osteophytes. B. Marginal erosions. C. Gull-wing deformities. D. Subcortical cysts. Which of the following is an unlikely radiographic finding in patients with erosive hand osteoarthritis? A. Osteophytes. B. Marginal erosions. C. Gull-wing deformities. And D. Subcortical cysts. Go.
Time's up. Raise your paddles. The correct answer is B. Marginal erosions. Correct answers are from Makati Medical Center and UPPGH. Oh. May mga nag-cheer doon, no? 50 points. Next question.
Next question. Number 9 ulit.
Second to the last. So, which is not
Wait.
advisable in the treatment of stage 1 rotator cuff tendinopathy? A. Application of ice. B. Rest shoulder for a while. C. Short course NSAIDs. Or D. Immobilization of shoulder. Which is not advisable in the treatment of stage 1 rotator cuff tendinopathy? A. Application of ice. B. Rest shoulder for a while. C. Short course NSAIDs. Or D. Immobilization of shoulder. Go. Time's up. Raise your paddles. The correct answer is letter D. Immobilization of the shoulder. Everyone got the correct answer. We have the last question.
Last for the moderate. Which is an important regulatory pathway for maturation of osteoblasts and bone formation in osteoporosis? Pinapahirapan ako. A. Estrogen endocrine pathway. B. TGF-B pathway. C. Wnt signaling pathway. D. RANK-OPG pathway. Which is an important regulatory pathway for maturation of osteoblast and bone formation in osteoporosis? A. Estrogen endocrine pathway. B. TGF-B pathway. C. Wnt signaling pathway. D. RANK-OPG pathway. Go.
Time's up. Raise your paddles. The correct answer is letter C. Wnt signaling pathway. Everybody got the correct answer.
Yan.
Okay, so let's review the scores. That wraps up round 2. Okay, leading the pack is East Avenue Medical Center with 120 points, followed by UPPGH and USA Hospital with 115 points each. And then
And-
not far behind are
Makati Medical Center with 110 and St. Luke's Medical Center 105.
all right. So one final cheer for our participants.
Kayang-kaya pa yan.
We have one more round to play.
Okay. We have one final round to play. Let's proceed to the hard round. The questions for this round are worth 15 points each.
Again, for one last time, if you want to make a substitution, except Dr. Julia, hindi pwedeng mag-substitute. If you want to make a final substitution sa teams ninyo, you may do so.
Substitution ba? Counting
5,
once,
4, 3, 2,
2, 1.
1. Okay, so gusto niya, they will stick with their team.
Okay. Okay, let's have the first question for the hard round. Difficult. Difficult. Which is not part of the 2016 revised diagnostic criteria for fibromyalgia? A. Widespread pain index of equal or greater than 7. B. Symptom severity score of equal or greater than 5. C. Presence of symptoms for at least 3 months. D. Generalized pain of 4 or 5 regions must be present, including jaw and chest. Which is not part of the 2016 revised diagnostic criteria for fibromyalgia? A. Widespread pain index of equal or greater than 7. SSS of equal or greater than 5. Presence of symptoms for at least 3 months. And D. Generalized pain of 4 or 5 regions must be present, including jaw and chest. Go.
Time's up. The correct answer is letter D. Generalized pain of 4 or 5 regions must be present, including jaw and chest. Everybody got the correct answer. Ba? Unang question pa lang, kuha na agad lahat, no? Next question. Number 2. What primary enzyme is responsible for progression and cartilage matrix degradation in osteoarthritis? A. Agrecanases. B. Metalloproteinase 13. C. Hyaluronidases. Or D. Cathepsin K. What primary enzyme is responsible for progression and cartilage matrix degradation in osteoarthritis? A. Agrecanases. B. Metalloproteinase 13. C. Hyaluronidases. Or D. Cathepsin K. Go. Time's up. Raise your paddles. Correct answer is B. Metalloproteinase 13. East Avenue Medical Center, Makati Medical Center, and St. Luke's Medical Center got the correct answer. Malapit.
Next question. Which protein is present in RA synovial fluid and the gene of which is expressed by synovial tissue macrophages? A. Interleukin 10. B. Interleukin 1 receptor antagonist. B. Transforming growth factor beta. D. Soluble cytokine receptors and binding proteins. Which protein is present in RA synovial fluid and the gene of which is expressed by synovial tissue macrophages? A. Interleukin 10. B. Interleukin 1 receptor antagonist. C. Transforming growth factor beta. D. Soluble cytokine receptors and binding proteins. Go.
Time's up. Correct answer is letter A. Interleukin 10. Nobody got the correct answer, unfortunately. Next question. Fourth question in the difficult round. Which is the most commonly affected cervical nerve root where there is pain and numbness on the posterior aspect of the arm and forearm up to the middle finger with slight weakness at the back of the upper arm? A. C5. B. C6. C. C7. Or D. C8. Which is the most commonly affected cervical nerve root where there is pain and numbness on the posterior aspect of the arm and forearm up to the middle finger with slight weakness at the back of the upper arm? A. C5. B. C6. C. C7. Or D. C8. Go. Time's up. Correct answer is letter C, C7. Everybody got the correct answer. Parang sa difficult yata humahataw yung mga contestants, no?
We have announcement from the Board of Judges. We remind you to raise your answer within the 5 seconds, no? Kasi kung after that, it will be invalidated.
So pag sabi ng go, pwede nyo nang itaas. And then within 5 seconds from that. Next question.
Number 5, which is considered the HLA susceptibility region for psoriasis, where patients harboring this gene present with earlier age of onset, more extensive and severe disease. A. HLA-B27, B. HLA-B38, C. HLA-C01, D. HLA-C06, which is considered the HLA susceptibility region for psoriasis, where patients harboring this gene present with earlier age of onset, more extensive and severe disease. A. HLA-B27, B. HLA-B38, C. HLA-C01, D. HLA-C06. Go.
Time's up. The correct answer is letter D, HLA-C06. Only Makati Medical Center and St. Luke's Medical Center got the correct answer. So, since we're halfway sa final round, we're going to review the scores. Makati Medical Center and St. Luke's Medical Center, sir. Okay. So, we're going to review the scores.
Review the scores para alam natin kung makakahabol, paano hahabol.
Okay, leading the pack. We have a new leader.
Yeah. Makati Medical Center with 170 points.
And then tied for second place, East Avenue Medical Center and St. Luke's Medical Center with 165 points.
And we have UPPGH and University of Santo Tomas, 145 points.
Okay, so we have 5 questions to go, worth 15 points each. Can still be anybody's ball game, no?
Yes.
All right, so are we ready? Next question. Question number 6. Which finding suggests a high-risk histologic feature of lupus nephritis? A. Cellular crescents. B. Mesangial proliferation. C. Increased mesangial and endocapillary cellularity. Or D. Prominent capillary walls of glomerular tuft. Which finding suggests a high-risk histologic feature of lupus nephritis? A. Cellular crescents. B. Mesangial proliferation. C. Increased mesangial and endocapillary cellularity. Or D. Prominent capillary walls of glomerular tuft. Go. Time's up. Raise your paddles. The correct answer is letter A, cellular crescents. So everybody got the correct answer. Okay, we're almost at the
Next.
end.
Number 7. Which basolateral surface transporter at the renal tubule responsible for urate excretion is inhibited by loop diuretics, thus contributing to the increased serum uric acid level? A. UR80, 1. B. GLUT9A. C. OAT1. D. NPT. Which basolateral surface transporter at the renal tubule responsible for urate excretion is inhibited by loop diuretics, thus contributing to increased serum uric acid level? A. URAT1. B. GLUT9A. C. OAT1. D. NPT. Go.
Time's up. Correct answer is Letter C, Oath 1. Only East Avenue Medical Center got the correct answer. Lakas ng cheer dito, 50 points yun. Okay. Next question. Question number 8. Third to the last. In patients with inflammatory bowel disease, which biologic drug can cause bowel disease flares but with good effect on joint disease? A. Adalimumab. B. Etanercept. C. Golimumab. D. Infliximab. In patients with inflammatory bowel disease, which biologic drug can cause bowel disease flares but with good effect on joint disease? A. Adalimumab. B. Etanercept. C. Golimumab. Or D. Infliximab. Go. Time's up. Raise your paddles. Correct answer is letter B, Etanercept. St. Luke's Medical Center and UPPGH got the correct answer. Lakas ng cheer.
Humahabol.
Grabe.
Next question. Second to the final question.
Second to the last question.
Which is the most common cutaneous finding in Behçet's disease? A. Papulopustular lesions. B. Erythema nodosum-like lesions. C. Neutrophilic dermatosis. D. Erythema multiforme. Which is the most common cutaneous finding in Behçet's disease? A. Papulopustular lesions. B. Erythema nodosum-like lesions. C. Neutrophilic dermatosis. D. Erythema multiforme. Go.
Time's up. The correct answer is letter A, papulopustular lesions. So, East Avenue Medical Center, Makati Medical Center, St. Luke's Medical Center, and UPPGH got the correct answer. Nagre-Raynaud's phenomenon na yung mga mentors, oh.
Raynaud's phenomenon ba dahil sa lamig o dahil nagfi-feast na sila?
Baka magka-gout flare yung iba dyan kapag...
Gumaganon na yung iba.
Okay.
Last question.
Last question. In the absence of active myocarditis in SLE, which pathologic finding distinguishes hydroxychloroquine toxicity? A. Myocyte vacuolation. B. Perivascular mononuclear cell infiltration. C. Interstitial scarring. Or D. Perivascular fibrosis. In the absence of active myocarditis in SLE, which pathologic finding distinguishes hydroxychloroquine toxicity? A. Myocyte vacuolation. B. Perivascular mononuclear cell infiltration. C. Interstitial scarring. Or D. Perivascular fibrosis. Go. The final 5 seconds. Time's up. And this concludes the program. The correct answer is A. Myocyte vacuolation. The correct answers, everybody got the correct answer. Okay. So we'll take a look at the scores. I think we will do a sudden death.
Okay, let's review the scores.
Let's review the scores. Okay. So, leading the pack,
Leading the pack, we have East Avenue Medical Center, 225 points. Tying up with St. Luke's Medical Center with 225 points as well.
and then this is followed by Makati Medical Center with 215 points, and then UPPGH with 205 points, and USC Hospital with 175 points. So, di pa tayo tapos, Jopat.
Yes, so
Meron pang extension.
so may tie. So we have a tie. In case that we are going, we have a tie, we will have sudden death question to
Okay,
be
so-
given by our board of judges. Ang magsasagot na lang ay yung East Avenue Medical Center and
And
St. Luke's Medical Center.
Alright, isang cheer naman from the trainers and friends of East Avenue Medical Center. Ito pala, nandito pala yung mga EAMC. How about from St. Luke's Medical Center? O, tig 50 points kayo, pantay lang. Alright, we will wait for the sudden death
Congratulations sa
questions.
lahat, no?
Yeah, I think it's been very fun
Yes.
and exciting.
Exciting. Nakakakaba.
Tingin ko, dapat may kasamang mentor nga sa tabi, no? Next year. Okay, so sa sudden death,
Saglit.
hold on. There will be 5 random questions of varying levels of difficulty. So halo-halo na to. May easy, may moderate, may difficult. And the first one to reach 3 correct answers or the highest pointer of this round will be declared the champion.
So ang sasagot lang ay
Ang sasagot lang ay East,
East
Avenue Medical
Avenue
Center
and
and St.
St.
Luke's
Luke's
Medical Center.
Medical Center.
Pero yung iba, they can stay, sir, para for the picture taking later.
Kasi aakyat rin kayo mamaya sa stage.
So, ayan na. Naku, nagsa-sign of the cross na yung East Avenue. Pati nga ng palad mo, nagkaka-vasculitis na. Yung St. Luke's. Raynaud's.
So this is sudden death. Ibig sabihin, pag nakuha nung isa, that institution will already be declared the winner.
The first one to get the highest score or the first to get
Correct answer.
3 correct answers. The first to reach 3 correct answers or the highest pointer
Isa
of the
lang.
round.
Oh, one lang daw, sabi ng Board of Judges.
There's a change in change in ruling. So just one question, sudden death. Kaya sudden death. If you don't get the correct answer, you're dead. Okay, we'll wait for the technical team to prepare the questions.
Isa lang, no?
Showbiz yata yung category nung nung sudden death. So, tama ba, Joban?
So the question will come from Dr. Hipe. Yeah.
Which is the highest grossing Philippine movie in the... Ano ulit, Jeanette, yung sinasabi mo kanina? Metro Manila Film Festival, the highest grossing movie.
Mukhang binubuo pa nila yung question eh.
Ready na? Alright!
Ready?
So, ito na. The moment of truth for East Avenue Medical Center and St. Luke's Medical Center. Ready, East Avenue? Ready, St. Luke's? Alright. Ready, trainers? Time out, sir. First to 15 points daw ulit. First
Ha?
to?
Saglit.
Okay, we will confer.
Mag-uusap pa ang chairman of the convention and the board of judges. Whatever kung ano mapag-usapan nila,
Right, minus wrong daw to. Hindi, joke lang. So, antayin natin ang mga final decision, no? In the meantime, interviewin muna ni Pat yung East Avenue. Sino ba team captain ninyo? May team captain? Okay.
wala rito yung pangalan nila.
Sa St. Luke, sino team captain? Nasa gitna.
Mukhang meron kayong libreng ano dyan, raisin bread from your mentors. Yung mga nahuli, baka may kulangot lang. Meron pa ba yung kulangot dito? Meron pa? Oo, meron pa yung kula-kulangot lang.
Alright, so ito na yung final decision. So it will be a sudden death. So the first one to get the correct answer will be declared the champion. Hindi,
No,
ganun pa rin.
it will still be on the 5 seconds. You will be allowed to raise your paddle answers after we say go.
Correct. Okay. Are we ready? Ready, everyone? The final question is, who are the 2 past presidents of PRA who served the organization 10 years in total? A. Abelardo M. Inocentes and Sandra V. Navarra. B. The correct answer is letter B. O at least you got a history lesson, di ba? We got a very good history lesson yesterday from Ma'am Pen's lecture.
Kasi andun na yung sagot.
Oo, kung nakinig kayo, nandun yun.
Sample.
Sample lang.
Lalo tayong kinabahan yan.
O, palakpak muna, palakpak.
But nonetheless, that's a good history na malaman natin. No?
Oo, I actually had a good history lesson under Ma'am Pen's lecture yesterday. So,
Ready? Di pa. Binibilang nila kung ilang taon yung ano. Ready na raw. Okay. We have a signal from the judge already. Which of the following environmental and occupational exposures is consistently associated with the development of ANCA-associated vasculitis? A. Crystalline silica. B. Pesticides. C. Heavy metals. D. Organic solvents. Which of the following environmental and occupational exposures is consistently associated with the development of ANCA-associated vasculitis? A. Crystalline silica. B. Pesticides. C. Heavy metals. And D. Organic solvents.
go. Ako, may mananalo o may matatalo.
Naku, magkaiba sila
Magkaiba
ng
ng
sagot. Stop.
Babasahin ko muna yung sagot nila, ha?
Huwag mo munang i-ano yung
I
ano.
will read their answers. Okay. East Avenue Medical Center answered letter A.
St. Luke's Medical Center answered letter C.
Hold on. And the correct answer is letter
A.
A.
Crystalline silica. Yes.
Wow. So, we have a winner.
Yes. That wraps up the contest. So we have a winner.
Our winner. Okay. Before we announce the winner, alam nyo naman na kung sino. May we call the other participating ATIs with their coaches and training officer for a photo shoot in front. So, we'll call all of them at the same time na, ha? From Makati Medical Center, please proceed to the stage with your coach and or your training officer.
May we also call the PRA President, Dr. Emmanuel Perez, the overall chair of this year's PRA Annual Convention, Dr. Rosario Baez, the Scientific Committee Chair, Dr. Harold Michael Gomez, and
The
the PSBR, led by the Chair, Dr. Lenore Lugie Lizardo, to join the training institutions for photo shoot.
Okay, so let's call the training institutions. Tawagin muna natin ang Makati Medical Center and their coach or trainer.
Lahat na. Sabay-sabay na.
Okay, tawagin na daw lahat. Makati
except
Medical
medical.
Center, Philippine General Hospital, University of Santo Tomas, and St. Luke's Medical Center. Please proceed to the stage for your pictorial. Trainers, coaches, mentors, please accompany them on stage.
Please come on stage, except for the East Avenue.
Okay.
Okay.
We'll call East Avenue on stage also so you can have a group picture with everyone.
Lahat na lang muna.
Okay, please proceed to the stage, everyone. Let's give our participants and their coaches and trainers a warm round of applause. Okay, so again, East Avenue Medical Center, Makati Medical Center, Philippine General Hospital, St. Luke's Medical Center, and UST, please proceed on stage. And do your celebrations later. Okay, sige. Please,
Sila. Doc?
PSBR, kindly join our contestants on stage. Okay, so this is Philippine General Hospital with their coaches, trainers, chair, and training officer.
Okay. Ah,
Ay, okay.
PG. PGH muna.
All right.
Okay,
so,
next.
University of Santo Tomas Hospital.
Congrats. Congrats. Okay. University of Santo Tomas.
Okay, UST Hospital. Okay. Si Doc Evan, dala-dalawa eh, no? Alright. Thank
Same.
you, UST Hospital.
Makati Med ba to?
Makati Medical Center.
Next, Makati Medical Center. Parang nakakatakot mag-rounds after the convention. No?
Totoo. Okay, let's wait for Dr. Andre. Thank you, Makati Medical Center. And
So let's have
congratulations.
St. Luke's Medical Center.
St. Luke's Medical Center. Lumabas yung sagot. Congratulations. Ay, sorry. Sorry. All right. Next year. And let's now call the grand champion of the first ever PRA Rheuma Laban, the one who will carry the bragging rights, the cash and the trophy home from the East Avenue Medical Center. Let's call on the participants, the trainers, and their mentors. Congratulations, East Avenue Medical Center. So they will receive this elegant trophy, 8,000 pesos in cash, and of course, bragging rights.
Check.
Yes, congratulations, East Avenue Medical Center.
Okay. That wraps up the PRA Rheuma Laban 2023. Congratulations to East Avenue Medical Center. Hopefully, we can do this annually so that everybody can defend their championship. Thank you for all the participants, their coaches and trainers. To the organizers, we have Dr. May Andres and staff. And to the PSBR for their efforts to make these Rheuma Labans a success. This has been your host, Joseph Patricio.
And Alan Corpuz.
Good morning,
And
and
we'll
we'll
see
see
you
you
in
in
the
the
next
next session.
session.